Up next, I hope you'll enjoy a skit by Pedro Sanchez.
Hodgkin's disease is a lymphatic cancer. People who usually get this type of cancer notice that one of their lymph nodes in their bodies have painlessly swollen. Hodgkin's disease usually affects only the lymph nodes, but if the cancer is not treated, the disease can spread to the bone marrow or their lungs and liver, which eventually leads to death. Unfortunately for Hodgkin's disease patients, people who are diagnosed with Hodgkin's must have a piece of their liver removed to be checked if their liver is infected. Mostly, people have a chunk of liver removed from their bodies for no reason at all. Also, people who are diagnosed with this type of cancer notice that they have lost a significant amount of weight, lose their appetite, and get fever and chills. Hodgkin's is one of the two types of lymphatic cancer, non-Hodgkin's disease being the other. However, Hodgkin's disease, which is about 10,000 people are affected every year, is not as widespread as non-Hodgkin's disease, in which about 50,000 are affected each year. Among this 10,000 was my mother, who was diagnosed with Hodgkin's disease when she was 23. Scientists can tell the difference between Hodgkin's and non-Hodgkin's by the presence of a certain cell called the Reed-Sternberg cell. When the cell is present, this means that the patient is infected with Hodgkin's disease. Hodgkin's disease is now usually curable, but this development is new in the field of science. 50 years before the radiation machine was invented, Hodgkin's was the most dangerous cancer ever, for doctors had no idea how to treat it. Fortunately, chemotherapy and radiation have both worked depending on the age and sex of the patient. In fact, my second cousin was one of the first people ever to be treated with this new type of technology and get better from it. There are 4 different stages of Hodgkin's disease. The first is where only one organ is infected. The second is where 2 or more lymph nodes, or an organ and a lymph node, are infected. Stage 3 tells us where both sides of the diaphragm are infected. And stage 4, where the whole body is infected. In most cases, stage 4 is incurable. No one is certain why some people get Hodgkin's disease and others don't, but there is a link between people with mononucleosis and another between people who get the measles. However, a new study has found that men more often get Hodgkin's disease than women. No one was certain why until scientists started doing research, realizing that many men who worked in lumber mills or places with chemicals had a large risk of getting Hodgkin's. Some believe that when breathing in particles in the air that are bad for you on a regular basis leads to this type of cancer. Because no one is certain what the cause of Hodgkin's is, it is hard to know how to prevent it. However, the new idea that pollution could be a factor in why some get it is helping scientists learn how to prevent it. A way one might avoid Hodgkin's is to check and find any dangerous toxins in your home, especially metal and lead, and make sure that the rooms you are in are well ventilated at all times.